Hi, everybody. Just wanted to give a update related to some COVID data, reiterate some messaging with the vaccine. Looking at our data today, unfortunately, we lost an 80-year-old female to the virus. Certainly want to think about her and her family and all the families who have lost loved ones. It's been a long pandemic, and this is a deadly virus, one we need to continue to respect. Um, as we look at new cases, 101 new cases, so 2 days in a row, right at 100 or a little bit lower than 100, so this is good. We go into Thursday, Friday, Saturday, which are typically our higher case days of the week. So hopefully we'll continue to hold ground or make up ground related to that. Uh, Active cases are down to 1,966. So we continue to go down, meaning we have more recoveries each day from the virus than new cases. This has been a trend over the last probably 10 days. When we look at our daily positive rate, or a 7-day average, our 7-day average is at 2.7%. That is the lowest we've been since November 8th. This is really right before, this is kind of where we were before the Halloween surge started to impact our community. So this is really good. The difference between, think about September, October weather compared to a day like today, where certainly nobody is hanging out outside if they're going to be together. We were always going to struggle through winter months with indoor activities being heightened. So I think we're really in a good spot, and we need to continue to work at this and improve on this. Avoid the gatherings, the large gatherings, especially in inside homes, and certainly the key, I think, risk, which we were seeing at the end of the summer and the fall, was symptomatic spread. You're sick, you think it's something else. It's really not something else. It's COVID. So please, with symptoms of COVID, you need to get a test and stay home until you've ruled out COVID. So that's good. Hospital numbers, 125. That's down a little bit. Our total hospital numbers in the region are down in a good spot. There are 1,134 beds being used right now. Again, typically we have 1,700 beds. With the governor's orders, the beds were much more than that, more like 2,100 beds. So our capacity has gotten better. I want to thank our hospitals and all of our frontline workers for all the work that they've done to help get people better. We have 34 neighbors in the ICU. Certainly that number's up a little bit, so please keep them in your thoughts and prayers so that they can get home to their families and their loved ones. But with hospitalizations, remember, it's not just one or two people that go in every day. The virus is very tough, and for example, we had 12 new admissions yesterday, but we had 14 discharges. So the hospital teams are doing such a great job treating this, and there's better therapeutics now than there was. But when you get this, you still have a very hard time. This isn't something you want to have happen to you or your loved ones at all. Um, Looking at out of our new cases, only 2 of them were residents of nursing homes, so 2 out of 101. So that's pretty good. We attribute a lot of that to the vaccine. Most residents in the nursing home and senior congregate facilities have received the vaccine, 2 shots at this point. So that's beginning to have an impact. Just looking at things as we talk about vaccine and vaccine eligibility, I just want to give some context to everybody. You know, we get a lot of emails about who should be eligible, who shouldn't be eligible, and everybody should be eligible, right? Everybody who wants a shot should be able to get a shot. We just don't have the supply right now. So it's a tough spot for us to be in. And so out of those who are eligible now, there's still tens of thousands of people. And many of these are the individuals who have the worst outcomes with the virus, right? So I'm going to just remind people, we've lost over 600 people to this virus. Uh, we've lost 4 people under the age of 40. That's 4 too many. Those 4 people had pretty severe pre-existing conditions. What we know is that this virus is lethal to our seniors and to those with pre-existing conditions. And so right now, there's eligibility set by the state. The governor yesterday said moving forward is not today for vaccine, but the governor said moving forward that counties can make the decision whether or not to vaccinate essentially your restaurant workers and taxi drivers, Lyft drivers, Uber drivers. We're not ready to make that decision today, and there's no vaccine even if I said today that we are ready to make that decision. And I know for some of you that makes you angry with me because you've been calling my office and telling everybody that works for me that. But here's why. That we have not even gotten to our seniors. And they're the ones that if they get this virus are more likely to go into the hospital and then have a very bad outcome. The data says it. So what we don't know right now, and again, we'll share the data tomorrow. I haven't even seen the data yet for our pod. I think the sample size is enough now where we can release the data and have a discussion about it for our pod. But we're trying to get data from pharmacies and then the state fairgrounds as well. But right now, if we have 60,000 or 65,000 eligible people still, and we're only getting 1,000 or 1,500 new vaccines next week, to bring on more people to that is creating a larger problem, especially if we don't know that we're making substantial inroads with our senior populations in those other eligible populations right now. So again, the governor was referencing eligibility for those 2 segments of the population for next week, not this week. And we're just not ready to make that call. And it's not that I don't want anybody to get the vaccine. I wish the issue was they sent me 467,000 first shots, and I had to figure out how to do it all. I'm not getting enough shots to be able to go do everybody that's already in line. So that's the challenge. So I ask for everybody's patience. We're going to review the data, and maybe we'll make a decision for next week. Maybe we won't, related to the taxi drivers and the Lyfts and the Ubers and all the restaurant workers. It's not that I don't value you or anything else, but just because you become eligible doesn't mean that you then get the vaccine right away. There's just not enough vaccine. So we're going to let the data, we're going to analyze the data. We'll talk to Dr. Gupta and her team, and then we're going to play this by ear. So hopefully people can appreciate that. To give everybody an idea on population, I understand with the vaccine, people are concerned about equity, and some people get concerned when we're not in their town or their village and we're in this neighborhood. Let's just go through some demographic information. The Asian American community makes up 3.7% of the county's population. African American, 11.4%. White Caucasian, 79.9%. Other being Latino and other races, 5%. We're going to look, and what our pod should tell us is that when we look at who we vaccinated, hopefully they look like those numbers I just said. And if they don't, then we need to address that. There needs to be equity in this process. And then we're going to look at zip codes. What percentage of the population lives in each zip code? Is there equity, or are our rural communities not getting enough of the vaccine? Are city neighborhoods not? Are certain suburbs not? These are all things we're going to start looking at because equity means something to us. And again, we're very pleased that we're going into some of these communities that we knew weren't meeting these marks last week. And hopefully after the last 48 hours with our clinics at the Syracuse Housing Authority and over at Dr. Week's school, hopefully we will be hitting these percentages or being very close to that. But again, we'll go over our pod's demographic information and data tomorrow. Tomorrow, there was 630 appointments that were put out earlier today. Uh, my understanding is they were taken up in 15 minutes. Not a surprise. My understanding was the technology did not falter this week. That's good news. We paid more money to make sure it wouldn't. Um, but again, I understand that many of you did not get an appointment and you're frustrated. So we'll continue to message out as new appointments become available with our other partners. And when we get it, again, we are asking for lots of vaccine, like a broken record, every day, and we'll continue to do that until we have enough vaccine where we can't vaccinate anymore. And that's a lot of vaccine. Right now, our pod is doing essentially 1,200 vaccinations this week for first doses, and we can do 18,000. So we got a lot of room to grow here, and hopefully we will. But that's today's update. Again, I understand this is an emotional process. There's a lot of anxiety in the community related to the vaccine. I know it's our ticket to take back our lives from this virus, and we're going to do that. We just need to be patient, and we're going to get to everybody. Our teams will work tirelessly with all of our partners to make sure that we vaccinate and vaccinate quickly. To give everybody context, the Central New York region, your county, has vaccinated 97% of the supply they've been given. Okay, 97%. We got the supply yesterday. So 97%. So we'll be done with all of this on Friday. So our week, Wednesday to Wednesday, Friday, it will be out of vaccine where we could keep vaccinating first doses. That 97% is the best in New York State. So it's not that we're sitting on any vaccine. Once we're done, we ask the state for more. There just isn't any more at this point. So that's kind of where things are. We'll get through all of it. The data continues to improve and hopefully stabilize around these levels, if not a little bit lower. And this is going to come to an end in 2021. So just hang in there with us, and we'll get through all this. Thank you.